Okay. So, I am going to go through and explain, um, like showing an X-ray, showing when we do an extraction, why we do bone grafting, um, the options for replacing a tooth when we lose a tooth, things like implants, bridge, bone grafting, sinus lift, all of those things. So I'm going to share my screen. So everything that I show, all of the x-rays that I'm going to show, um, are just off Google. Nothing is, secure patient information. Um, so I'm going to start with, let's take a look at this panel. So when we have an extraction, um, what's going to happen, so you can see this tooth right here, there's some infection here, and this tooth needs to be extracted. So when we do that, we're going to take this tooth out, and you can see the margins here. This is where we're going to be left with a hole. So same thing, if we were to take this tooth out over here, all of this right here, you'd be left with a hole right there. So when we take teeth out, you have that cavity and your bone grows slower than your gum tissue. So the gum tissue is going to start to fill into the hole, and the bone is going to also start filling from the bottom up and just across. Same with gum tissue, it's going to grow across and up as well. But because that gum tissue is going to grow faster, when that bone meets that gum tissue, it's not going to push the gum tissue out of the way. So our concern with oral surgery, and if somebody is wanting to replace this tooth later on, is that if they don't have enough depth to be able to place that implant, then they won't be able to replace the tooth. So when we talk about depth, you can see through this channel here and through this channel here, that's where we're going to have that nerve. That nerve is going to give our face all of its feeling. So this nerve is going to make it so that we can feel our tongue, our lip, our cheek. So if that's damaged, then we're not going to be able to feel that. So let's see. I'm kind of playing with this and figuring this out, so you're going to have to bear with me. All right, so let's go back to this. So when we take this tooth out, what we want to be sure of is that we have enough depth from here to be able to place an implant. So this particular x-ray, that's not much space already. So if they lose any more depth, then replacement is not an option. So bone grafting is going to be very important in this case, so that way they can replace that tooth. So we would take, we use cadaver bone in our office. So we would take that, we would pack that into this hole, and then that's going to preserve the level of or depth of bone that they have. So then we would go back in and we could place the implant. If they lose so much bone, like I said, if the bone comes down to right here, and then we only have from here to place an implant, well, that's not going to be enough before we hit that nerve. Our implant would go through the nerve, and like I said, they would lose all feeling. So that's going to be our concern on the bottom. There are different options for replacing a tooth. So a tooth that's in the back right here, your only option to replace this tooth is going to be an implant because it doesn't have anything next to it. So what I'll show next is going to be a bridge. So you can see here, by missing this tooth, they could have done an implant or a more affordable option if somebody can't afford an implant, or maybe they just don't like the idea of having a foreign body like drilled into their jawbone, then that's also, another reason that a patient might not want this. So the other option is going to be a bridge. So a bridge is going to be a really great option for somebody who has this tooth extracted and then maybe has something going on with this tooth and has something going on with this tooth, because what you're going to have to do is you're going to have to shave down this healthy tooth or not healthy tooth and then this tooth. So you don't want to do that to a healthy tooth because it's a healthy tooth and you're shaving it down. And when you do that, you're going to lose the integrity of that tooth. So for this particular patient, it looks like they opted for a bridge. So this is floating like a bridge would be. So you shave this tooth down, and then you do a 3-unit bridge. So one on this tooth, one on this tooth, and then this is just floating here. So the downside to a bridge is that this patient's going to have to really make sure that they are cleaning underneath of here, because food can get trapped underneath of here and then lead to further decay of this tooth and this tooth. The other downside is going to be that the longevity of a bridge is not going to be what an implant is. So we usually say an implant, by the time somebody's coming in, usually just the nature of the beast with, as we age, we start to lose teeth. So usually by the time somebody has reached the age where their teeth are aging with the rest of their body and they are losing those and need to replace them, our hope is that the implant is going to last them a lifetime. So the bridge is, I've seen most bridges last around 10 years. I would say upwards of best bridges. I think I had seen one that was like 15. So the problem is that when you do that option and then you lose that bridge after 10 years, and it could be sooner than that, and most definitely could be, you're not only going to lose this tooth here that you lost previously, but now you're also possibly going to lose this tooth and this tooth. It really just depends on what's going to be underneath of that crown. You may be able to redo it, but if you don't have enough tooth surface for this crown to be able to glue onto or this crown to be able to glue onto, then unfortunately, that's going to go. So then let's say it's this tooth that goes. Well, this one already has a crown, and maybe if this is okay, then we can do a 4-unit bridge. One floating here, one floating here, and it would be attached to this tooth and this tooth. But again, when you lose that, now, you're possibly losing 4 teeth in that area. So the other option that somebody might say is like, why replace it at all? It's in the back of my mouth. I don't even realize it's there. I'm hardly, I don't see it when I smile. I can chew without it and I don't notice. So the reason we are going to want to replace these teeth, these back teeth are our workhorses. These are those ones that we're really using for chewing, even if they don't necessarily feel a difference. Our body is designed the way that we know that it works. So when this tooth comes out, if you don't replace it, this tooth up above here becomes non-functional, meaning it doesn't have a tooth below it to chew on. What this tooth is going to do over time is it's going to keep dropping down because it wants to find something to chew on. So then eventually you may lose this tooth. Or now we're chewing a lot with this tooth and this tooth. So they're just taking on more forces necessarily than what they were used to. So now maybe this tooth ends up fracturing, or maybe we lose this tooth, and then we start to shift over here to chew. Or we start using this tooth to chew, but this tooth isn't particularly one that does a lot of our chewing. So now this fails. So then it kind of just begins to cause this domino effect. So ideally, we really want to be replacing teeth. Our teeth are not just meant for aesthetics. They're really meant for, our overall chewing which is our overall health. Because if you can't properly eat food, then you can't nourish your body. And then not only, are your teeth failing, but then your diet may change, and then that's going to lead to other things. So we really want to make sure that we are replacing these teeth. So it is a shame that some people may opt for something like a bridge just for affordability. But you don't love that option. The other thing is that when you take out a tooth and you do bone grafting, the bone grafting at least is going to buy us some time. Let's say this patient may not have money for an implant right now, or maybe they don't have the dental benefits for an implant right now. But if we do the bone grafting, then that buys us a little bit of time. So bone is like muscle. When you don't use your muscles in your body, they get smaller and they deteriorate. So bone is the same way. So our teeth are what stimulate our bone to stay in place. Um, so if we take this tooth out and we put bone grafting in, then eventually that bone grafting is also going to disappear as well. But it buys us some time where we wouldn't have as much time. If we're already starting with a deficit of bone, then we're going to continue to lose even more. So when we talk about, let's see, stay in the call. Let's stop presenting. So when we are talking about losing bone, one of the other things to really consider is that when you have dentures, some people may think just, okay, well, if I lose all my teeth, then I'm just going to get dentures. But when it comes to dentures, dentures don't stimulate our bone the way teeth do. So you'll notice, let me see if I'm going to pull up something here in Google in a second, but you'll notice that if somebody has a denture, it may fit them right now and it may fit perfectly. But because we're going to continue to lose bone over time, people will need to get their dentures relined and refit because they're going to start slipping out. They're going to move around, so then you can't chew. And then you're just going to continue to lose bone. So what we ideally would like to do, I'm sorry, you might be able to hear the clacking of my dog's nails on the floor. So ideally what we like to do is we replace those missing teeth with implants, and your denture will have kind of like little snaps in the bottom of it. Your implant will have little, posts sticking out, and the denture will snap into the implants. So implants are going to stimulate the bone the way teeth do. So it's going to keep that bone in that area. So you'll notice, let's Google denture facial collapse. Sure. Okay. So this is kind of what I'm going for. So we can see here your teeth are really stimulating that bone. So when you have no teeth there, you can see your lip starts to go in. Your teeth are also holding your lip forward. And then eventually just everything starts to sink in. So not only is it going to be a matter of, really giving your lips that plump, full effect, it also is going to eventually lose bone and affect how you chew. So let's go back to present now, entire screen. I'm learning as I go. Okay, so the other option, so if you're losing multiple teeth, the other option is you can do a bridge with implants. So kind of like that x-ray that we were looking at a moment ago, that 3-unit bridge. So when those teeth came out, maybe this patient is going to be in a different financial position 10 years from now, which is fantastic. Now they've lost those teeth and they can replace it with implants, and that's a more permanent solution. Not that a bridge isn't permanent, but it's not lifelong. our hope is that these implants will, and if that bridge lasts them 10 years and by the time they got implants, we're really hoping that this is something that will have longevity for them. So this image here pairs up with this pano. So after we would do an extraction here on that bottom tooth, so you can see this nerve here. So this implant in particular, this is I think it's a Bio Horizon, or actually it might be 3i. I think it's a 3i short. Most of our implants that we use in the office, we typically use Zimmer. The shortest Zimmer implant is 8 millimeters long. So this particular implant, I think, is 5 millimeters long. So from here to here, 5 millimeters. So you can see that, this channel running here, if we were to place an 8 millimeter implant, we'd be into that nerve. So this patient would lose all feeling. So, you can see this bone height here. If you don't do bone grafting, maybe that might be the outline, I can't really tell. But if you didn't do bone grafting, then there would be no way. We're already, for this patient, we would be placing a short implant already. And if this was our patient and we were not doing bone grafting and then they came back, the chance of really being able to place an implant at that point, I mean, I think the 5 millimeter is the shortest implant. So replacement just really would not be an option. So we talked about the bottom, the concern being our nerve. On the top, our concern is going to be our sinus. So like we had discussed, when you take a tooth out, if you don't have that tooth there to stimulate the bone, you lose it. So in this x-ray that we're looking at, you can see the sinus comes here and drops down. So looks like, again, this is just a Google image, but I'm assuming this patient has had this tooth here, particularly they did a bridge, which means this tooth here has been out of the mouth maybe for some time. So they've lost that bone there. So replacing this tooth with an implant, especially if this is to fail and this is to fail and these are all extracted, doing that is not going to be an option. So what we're going to have to do is going to be a lateral open sinus lift. So I will show you what that would look like. So this is just a different Google image, but here you can see this sinus would be dropping down. So we go and we place bone into the sinus. You can see this hump here, and then that's all bone. And then you place the implants into it, and then you add the teeth. So the way that lateral sinus lift looks, this would be our approach. So you go, let me show my camera, stop presenting. So if I were to lift up my lip, you go right here. Sorry, I'm figuring this out. Present now, entire screen. So you would add the bone, you would initially drill here. Whatever they're doing here, this is different than our approach in our office. We usually do a kind of like an indented oval. We kind of just make our markers into the bone and then kind of go around and push that flap of bone in. I'll show an example in a moment, but really the way I like to describe it is an eggshell. So cancel. So you can see here, so if this were the front of the face, this is more like what we do. We make a little indentation. Then this piece of bone here, kind of, you use it to push that in. So you can see this little membrane layer here. So I kind of like to describe this as a hard-boiled egg. So this outside bone layer is going to be the shell of your egg. And this inside layer here is that like thin layer that you have in a hard-boiled egg. So you use that flap. That flap now becomes the top surface here. and then you pack bone into this hole, and then that's where you get that little hump, and then you place your implants. So if I Google, let's say lateral sinus lift egg. So you can see even a way to practice. So you do the little indention here, and then we have a kit or sinus lift kit that kind of looks like a bunch of curettes, and you just slowly would take that curette and kind of slip it in between the shell and this membrane layer and just gently pull it away from that bone, and that's exactly what you're going to be doing in the sinus. So yeah, so that would be our sinus lift. So then we would have the room to place our implants and go without going into the sinus. Because the thing is if we were to place implants, if we were to place implants just straight up into this, we would go into the sinus. And as everybody knows, if you've ever known anything about a sinus, your sinus is just an empty cavity. So see, step presenting. So your sinus is just an empty cavity. So if you were to place an implant and it goes into that cavity, or we've even had it before where general dentists have tried to extract teeth and they've accidentally pushed the tooth through the sinus, and then it's very close to be able to just kind of float up into the sinus. So you have to be very careful. You can probably even, like, if I Google right now, implant in sinus. So, yep, there they are, just floating around up there. Because again, if you're not making sure that you have that depth and you're not going into the sinus, then the sinus is an open cavity. It is just going to, oh, wait, sorry, I wasn't sharing my screen. Anyways, the picture that I was showing, it is a implant just floating around up in the sinus. So if you Google an X-ray, if you just Google implant in sinus, you're going to see an X-ray and there's implants floating around up there. So that's going to be our replacement process. So yeah, that's why we're going to recommend bone grafting, so that they have that bone depth. And that's why you want to replace teeth typically with an implant. But again, that is going to be different and patient-based, just depending on the surrounding teeth that they have around it. An implant isn't always the best option. Sorry, my dog's tail is like hitting my desk. It really just depends on what other replacements they may be needing, and their long-term goal as well. If their long-term goal is possibly to do an implant supported denture, and we know that down the road there's going to be multiple extractions that need to happen, then we may not want to place that one implant right now. We may want to wait and do multiple extractions and then do an implant supported denture. So it's certainly not a one size fits all kind of option, but there are many things that go into play with that. So yeah, that is it.